Why are so many IVF doctors scared to do day 5 transfers? Everyone knows that all over the world, global best practice is to grow embryos to day 5 and then put them back in the uterus. Because the right stage for an embryo when it reaches the uterus is a day 5 or a blastocyst, not a day 2, not a day 3, not a day 4. So then why doesn't every IVF clinic do this? And the reason will actually surprise you. The reason is because these doctors do not have any confidence in their IVF lab. They do not have any confidence in their embryologist. They're not sure whether the embryologist will be able to grow the embryos to day 5. And some of them don't even have a full-time embryologist who will actually check the embryo growth. This is why they take all these shortcuts, which are terrible for the patient. It's great for the doctor because the doctor can do lots of IVF cycles for lots of patients and make a lot of money. But the pregnancy rate goes down dramatically because a day 3 embryo doesn't belong in the uterus, so the success rate goes down. But poor patients, they're clueless, they don't understand the difference, they accept everything the doctor says. And this is a big tragedy, not only for the patient, but for the entire IVF profession, because when doctors start cheating patients, the entire profession starts getting a bad reputation. Now, whether you have 1 egg or 10 eggs, you should still ask your doctor to do a day 5 transfer. And if he doesn't have the confidence that his lab is as good as the human body in being able to grow embryos to day 5, then really you need to ask yourself, then why is he doing IVF in the first place? Because an IVF lab can only be as good as the IVF clinician and the IVF lab. Because the IVF lab is at the heart of IVF, because it's the embryologist who's responsible for converting the eggs and the sperms into embryos. And if you can't do that well, you're not going to get pregnant.